This segment is sponsored by VCU Health.
The doctor is in and you have questions. Heartburn might seem minor, but it can be a sign of something more serious. Clinically, it's called GERD, and November is GERD Awareness Month. Here to talk with us is VCU Health's Dr. Guilherme Campos. But first, congratulations. VCU Medical Center's gastroenterology and GI surgery was recently named high performing by U.S. News and World Report, recognizing your team for going above and beyond national medical standards. Congratulations again.
Thank you very much, Amy.
This is a wonderful conversation to be having for GERD Awareness Month. What is GERD, and what does VCU Health do to help patients manage it?
It is a very common gastrointestinal condition that is manifested in about 15% of the general population. What happens is these patients have abnormal reflux of gastric contents into their esophagus, and this can lead to decrease in the quality of the life because of significant symptoms, and we'll talk about the symptoms in a little bit, but also inflammation in the esophagus and some other changes in the lining of the esophagus that can lead to more serious problems.
You had mentioned some of the symptoms. What are the most common symptoms of GERD?
We divide them in what we call typical symptoms and atypical. The typical symptoms are heartburn, that is a burning sensation that starts in your epigastrium and moves towards behind your breastbone. And this is the most common symptom of GERD. And two others are regurgitation. People feel their food or gastric contents coming up, or dysphagia, difficulty or pain at swallowing. The third one is a warning sign. If you have difficulty or pain at swallow, do look for a doctor immediately that you may have a problem. And there are the atypical symptoms. People may have chronic cough or tooth decay or otitis media or recurrent pneumonias in the absence of these more typical symptoms. So most commonly, it's heartburn, regurgitation, and dysphagia. But there are some other symptoms that may be related to GERD as well.
You had mentioned this. If you leave it untreated, it can lead to more serious issues. What are we talking about there?
So the most common things that we see, patients have inflammation in their esophagus called esophagitis. And esophagitis can lead to something called Barrett's esophagus. And Barrett's esophagus is a pre-malignant condition that needs to have screening and surveillance so it doesn't turn into a very deadly condition called esophageal adenocarcinoma, that is a cancer of the esophagus. So if you are a person that is above 50 with chronic GERD symptoms, especially people of white race, and if you smoke and if you're obese, you should likely have a screening endoscopy if you have symptoms of GERD to ascertain that you do not have one of those, that you don't have that pre-malignant condition.
What are some of the treatment options for GERD, and what makes VCU Health's approach unique?
So it is an entire spectrum. It includes lifestyle modification, includes weight loss, but includes a few medications, proton pump inhibitors, and more recently there are these medications called PCABs that are potassium competitive acid blockers. The medications can work wonder in a lot of patients. However, there are surgical and endoscopic treatments if you do not want to take the medication in the long term. And endoscopic treatment, the most common one used is a transoral fundoplication. It can be done endoscopically. And there are minimally invasive treatment that can be done using robotic or laparoscopic techniques that you can do a fundoplication or reinforce the lower esophageal sphincter, the sphincter between the esophagus and the stomach, to prevent reflux. And another common condition associated with GERD is a hiatal hernia that sometimes needs to be fixed at the same time of the surgical procedure.
Thank you so much for talking to us about this, such an important, timely topic for November GERD Awareness Month. Thank you for coming in today. We appreciate your time.
I appreciate the invitation.
For more information, you can visit vcuhealth.org. And stay with us. Virginia This Morning returns after the break.